Hello, I'm Greg Hoffman with Superior HealthPlan, and we're going to share with you some updates to our Star Health Medicaid services for children in the foster care program.
Superior HealthPlan provides health care for Texans enrolled in Medicaid, CHIP, Medicare, and the Healthcare Marketplace Exchange. We currently serve over 960,000 lives statewide. We became the first organization in the country to serve as a state's exclusive managed care organization for children placed in foster care. We share our expertise nationwide in Texas, Mississippi, Florida, and Washington, Missouri, Louisiana, Kansas, New Hampshire, Indiana, and California. And we are awarded a Star Health contract renewal in 2015. Listed here is a quick guide to the Star Health Program Enhancements for DFPS staff. It provides a listing of the health benefits available to Star Health members. General health screenings will now screen for SED for CSHN. Service coordination duties include ongoing support and education about the appropriate use of the emergency department, completing court orders involving health-related concerns, identifying health-changing conditions that warrant case management support, identifying and addressing preventive care and gaps in care, and making referrals to waiver programs. Members who may benefit from service management support are members in a hospital who have scheduled surgeries, receiving life-sustaining services or treatments such as enteral feedings, dialysis, oxygen, ventilators, chemotherapy, and/or radiation therapy, and who are using special medications. Complex case management members are identified as having uncontrolled, catastrophic, highly complex conditions. They may be in an inpatient facility or have complex medical or behavioral health conditions. Transitioning Youth Program Adolescent to Adult is a program offering reward dollars to young adults who complete wellness visits, dental checkups, and other health screenings. Discharge planning staff provide intensive transition planning, ensuring adequate services and supports are in place upon transition, confirms post-transition placement, provides linkages to new providers if pre-post transition placement differs, and follows up in person or via phone within 3 business days of transition to identify any further gaps in care and ensure services are initiated and meeting the child's needs. Start Smart for Your Baby manages our award-winning pregnancy and postpartum management program, which provides prenatal care access and pregnancy and birth outcomes for moms and babies. All Star Health members are enrolled, not just those with high-risk pregnancies. Members are assessed for special needs, ongoing education, assistance, and support on prenatal postpartum care and taking care of a newborn, and referrals are facilitated to appropriate providers or specialists. Transplant staff work closely with appropriate providers to obtain necessary clinical information and required lab work to facilitate timely evaluation of transplant candidates and assist in processing prior authorization requests for transplant services. They assist members in coordinating needed care and transportation and lodging for out-of-town evaluations or procedures. Transplant staff follow members up to 12 months post-transplant. Behavioral health clinicians and physical health nurses work closely together and develop an integrated service plan with goals to address physical health and behavioral health needs and improve appropriate utilization by facilitating specialist referrals and linkages to community resources. Smart Nutritional and Activity Program, or SNAP, is a program to improve body mass index for obese and overweight members with risk factors such as antipsychotic medication use and Down syndrome. The staff will assess the member's height, weight, daily physical activity, and nutritional intake, confirm current physical and behavioral health diagnoses and medications, and develop with the member and caregiver or consenter a service case plan and healthy behaviors care plan to improve nutrition and physical activity. Personal care services allow for attendant services to complete activities of daily living, such as bathing, dressing, eating, and personal hygiene, and instrumental activities of daily living such as meal preparation, grocery shopping, cleaning, and laundry for members that have the inability to complete these tasks independently on an age and a cognitive appropriate level. In 2015, the Texas legislation developed a plan to support the collaborative efforts of DFPS, CPS, community health providers, our MCO, and agencies licensed to care for children. In short, medical services for children requiring temporary or permanent care in the Texas foster care system have early screenings and assessment to support the best care and treatment. Whether abuse, neglect, exploitation, or other reasons children have been removed or rescued, the child's treatment and care will need to support their growth and development, education, social learning, and relationship success, which is tied to their experiencing both physical and psychological safety. This can occur through the State of Texas 3 in 30 initiative. Let's look a bit deeper at the details of 3 in 30. The Texas Child and Adolescent Needs and Strengths Assessment, or CANS assessment, serves as a comprehensive psychosocial assessment, trauma screening, and suicide screening. For youth and child protective services, the Texas CANS 2.0 assessment is a guide for service planning and determining levels of care for youth in the foster care program. This assessment supports decision-making in child welfare, mental health, juvenile justice, schools, and early intervention service provisions, including level of care, planning, well-being, and functional status outcomes to facilitate quality improvement initiatives. Versions of the CANS are currently used in every state, with statewide applications in 36 states, and there are implementations around the globe. The 3-day refers to the requirement of a medical exam by a medical practitioner within 3 business days of a child's entrance into CPS custody, meaning the child may be in kinship placement with a foster family, biological family, or in a residential treatment center. The 30-day refers to the start of a child's periodic visits with a TH-STEPS provider. This is to support assessing growth and development along mental, physical, visual, dental, and health stages. It involves physical examinations, interviews, and consultations with caregivers. It also includes initiating and maintaining the child's immunization schedule. When possible, all services provided at a child's medical home, such as a foster care center of excellence, can streamline the services of the 3 in 30 initiative. However, some agencies provide the CANS assessment, while the child's PCP provides the medical examination within 3 business days and the TH-STEPS exam within 30 days. For exceptions to these requirements, please refer to the DFPS Toolkit mailbox previously provided. We also offer additional training on this subject at involveyou.com. When the client is ready to book these appointments, remember, the 3 in 30 combines 3 separate yet critical tools for assessing medical, behavioral, and developmental strengths and needs of children and youth entering DFPS conservatorship. The state requires each component, and together the 3 assessments help chart the path for services of children and youth from the beginning of their time in the program. Under current law, children in DFPS care must receive the assessments noted within 30 days of removal. Starting January 1st, 2019, children and youth will be required to have an initial medical examination within 3 days of coming into care. By combining the statewide implementation of the newly required medical checkup and CANS assessment, DFPS can have a greater understanding of the needs and strengths of the children and youth in the program. The 3 in 30 is a collaboration between the Texas Department of Family Services, the Texas Health and Human Services Commission, and Superior HealthPlan. Listed here are the required assessments and the recommended timelines for each. As we think about 3 in 30 and the importance of informed consent, we must be mindful of the definition of parent specific to protection of children. A parent is defined as the mother, a man presumed to be the father, legally determined to be the father, who has been adjudicated to be the father by a court of competent jurisdiction, who has acknowledged his paternity under applicable law, or an adoptive mother or father. The term does not include a parent as to whom the parent-child relationship has been terminated. One way to look at the CANS assessment is with the who, the what, and the where. The who is Superior HealthPlan at 1-866-912-6283. It's recommended to encourage clients to have this number readily available so they can call Member Connections to gain support and access to network providers. A Members Connections representative will assist with their coordination of care and the scheduling of assessments. The CANS 2.0 is used for children and families by Superior HealthPlan providers. Training on the CANS is given by the Prade Foundation. The what is the CANS assessment. Training for the assessment is $12. However, a discount coupon code can be requested for groups of 5 or more. Email Lauren Schmidt for more information. And the where is available on the websites listed on the screen. All certified providers can be identified in Superior HealthPlan's printed Star Health provider directory. All children enrolled in Superior HealthPlan's Star Health program need a TH-STEPS checkup within 30 days of enrollment. All TH-STEPS screenings must be performed by a TH-STEPS provider in Superior HealthPlan's provider network and should include screenings such as measurements for height, weight, and infant head circumference, developmental and nutritional assessments, lead screenings, immunizations, and tuberculosis testing. Remember that annual medical checkups for existing members aged 36 months and older are due annually based on the child's birthday. For children younger than 36 months, checkups are due more often based on the TH-STEPS periodicity schedule. Listed here is the Star Health checklist, which can help guide you through the assessment process. It poses specific questions about the child's health, such as, has a TH-STEPS checkup been completed? Or do they know where their local urgent care clinic is located? Listed here is the Star Health process, which is broken down into 4 steps. Step 1 is to call for assistance. Step 2 is to report any barriers to the DFPS caseworker. Step 3 is to escalate any inquiries to the appropriate Star Health liaison for review. And Step 4 is to direct any unresolved concerns or complaints to Star Health or the Texas Health and Human Services Commission. Senate Bill 125 was related to certain assessments for children in the conservatorship of the Department of Family and Protective Services. The legislature focused on strengthening child protective services, and Senate Bill 125 improved the assessment of children who were removed from their homes by CPS. Often, children in foster care receive a number of costly evaluations and psychotropic drugs, experience multiple placements, and never find stability, permanency, and healing. This legislation ensured children are more quickly matched with the services they need, placed in appropriate settings, and not assessed or reassessed at great cost to the state. This created the CANS assessment. In order to administer the CANS assessment, providers can submit their certificate of completion to txcans@centene.com. Listed here are various case scenarios, such as Medicaid-covered services. These can be accessed without a court order as long as they're medically necessary. Services that are not medically necessary cannot be reimbursed by Star Health. If services are needed with a specialist, a referral may be required by the primary medical provider. Or non-Medicaid covered services, Star Health does not pay for non-Medicaid covered services. However, care grants, value-added services, and case-by-case services may be considered if appropriate and do not require a court order to be accessed. Court-ordered non-Medicaid services become the financial responsibility of DFPS. Another example is orthodontia, and these must be medically necessary for Star Health to pay. To start the process, the child or youth must be seen by their dentist for a referral to an orthodontist. The orthodontist must complete an evaluation to determine if services are medically necessary for Medicaid services to be covered. Our last case scenario is for placement. Placement is not a Medicaid-covered benefit and cannot be paid for by Star Health. Placement considerations must be secured through DFPS. Caseworkers must contact their regional well-being specialist to begin the court-ordered placement process. Listed here are the judicial points of contact for the various regions around the state. We thank you for attending this session of the 3 for 30 Foster Care Orientation.